Hello everyone, this is Dr. Ezi and I'm a member of the Royal College of Surgeons, Edinburgh, and I'm here to help you to pass your exams in MRCS Part B, okay? So we are still going on the pathology stations, and we will start a series of lectures that will take a new pathology station, okay? This is the second one which we are taking now. Okay, so there is a point before starting this station that you have to know, and this point is usually the examiners in the exam are told to ask you questions that are related to many pathological topics. So when you finish the stations, you will be tested in many topics, and in this way they will know that you already know many, because pathology stations I think are only 3 stations, and these stations, if we suppose that all the stations are 18, they will be 2 to 3. So they will test you in many topics, and every station will not be focusing on only one topic. They will take many topics in that station, and the scenario will contain many things that will be asked throughout the station. Okay, so we will take a new scenario. Okay, and the scenario number 2 will talk to you about a patient. He could be 37, he could be 39 years old, and this patient has hepatitis C. Okay, and this patient had an RTA or MVA, call it whatever you want to call it, a road traffic accident, and he had polytrauma. Okay, and he had a part of that polytrauma. He had an abdominal trauma, and he was diagnosed with splenic rupture, and he had huge bleeding. Okay, and they will tell you that this patient had splenectomy. Okay, which is a bloody operation also, and this is to tell you that he lost a lot of blood, and due to that this patient started blood transfusion. Okay, and this unlucky guy developed DIC, or disseminated intravascular coagulation. So this is the scenario which we are going to discuss. This station contains 25 questions minimum. Okay, so at least you want to answer 20 questions to pass the station and to get a good mark that will take you to the next level. So we will give you here all the questions of these stations and the answers that are required from you. So I will see you in the next lecture, starting with the first set of questions.